Hello, and thank you for viewing ETSU Family Medicine's video on accountable care organization workflows. Today we will be discussing the screening for clinical depression and the follow-up plan measure. The ACO describes this measure as the percentage of patients age 12 and older screened for clinical depression on the date of the encounter using an age-appropriate and standardized depression screening tool, and if positive, a follow-up plan is documented on the date of the positive screen. The initial population includes all patients aged 12 years and older before the beginning of the measurement period with at least one eligible encounter during the measurement period. The denominator equals the initial population. The numerator is patients screened for clinical depression on the date of the encounter using an age-appropriate standardized tool, and if positive, a follow-up plan is documented on the date of this positive screen. The only exclusions are patients with an active diagnosis for depression or a diagnosis of bipolar. On the Medicare assessment form, you will see two depression screening questions, which is considered the PHQ-2. In the last 2 weeks, have you had little interest or pleasure in doing things? And in the last 2 weeks, have you felt down, depressed, or hopeless? Patients are considered having a positive depression screening if they have answered yes to either PH2 screening question, and you must take action. If the patient answers no to both questions, no action is needed. Inside the note, you will see the results of the Medicare assessment form in the Prevention or the Medicare assessment form section. Scroll down to the two depression screening questions and review the patient's answers. And as you can see, this patient has answered yes to both questions, making this a positive depression screening. It is recommended that when the nurse is reviewing the Medicare assessment form, if they notice a positive PHQ-2, they will give the patient the paper PHQ-9 to fill out why they wait. The PHQ-9 will then be entered into the system as a flow sheet similar to the Medicare assessment form. This flow sheet will also show up in the Prevention or the Medicare assessment form section. As you can see, the PHQ-9 score shows that the patient has severe depression, and we must take action. When placing orders inside of Allscripts, you will notice order groups. If you are not able to see order groups, please click the Quick List button off and on, and then your folders will show up. On the Active tab, you will see two folders, one called Depression Screen PHQ-2 and the other Depression Screen PHQ-9. Since this patient scored positive on the PHQ-2, the diagnosis code should be added to the chart. Click on the Depression Screen PHQ-2 folder and add the code. Don't forget to add the code to the encounter form. After the PHQ-9 has been scored, if necessary, a diagnosis code should be added to the chart. Click on the Depression Screen PHQ-9 folder and add the appropriate code. Don't forget to add the code to the encounter form. Next, follow-up for a positive depression screening must include one of the following: an additional evaluation for depression, a referral to a practitioner who is qualified to diagnose and treat depression, pharmacological interventions or other interventions or follow-up for the diagnosis or treatment of depression. When you click on the Follow-up and Referral tab, or the Instruct tab, you will see an order group folder called Depression. Clicking on this folder will give you depression follow-up suggestions. Remember, these are only suggestions, and you can order whatever you feel is necessary for the diagnosis. Ordering education, referrals, and/or follow-ups will close the gap. Thank you for viewing today's video, and have a wonderful day.